Welcome tomorrow. Okay, well, first we're having some technical difficulties here with the feed, so maybe I'll move on to the next slide here, and Shamar, you can just jump in when you're ready. I'll talk a little bit about the Canadian Community Health Survey. So the Canadian Community Health Survey is a cross-sectional survey that's conducted by Statistics Canada. It collects information from the Canadian population ages 12 years and over. The survey collects key indicators of health related to health status. So that includes measures of well-being and overall health and disease. So examples of that would include respondents' perceived mental health, body mass index. It collects information on healthcare utilization, such as whether respondents have a regular healthcare provider, information related to health determinants and healthy behaviors. So for example, the amount of weekly physical activity or alcohol consumption respondents participate in or consume, and socio-demographic variables like education and income. The target population covers the population 12 years of age and over living in Canada. Data collection is via an online electronic questionnaire with phone or in some cases in-person follow-up. The survey uses a complex stratified sampling methodology. Each sampled household and individual is assigned a weight to ensure that the survey results are representative of the entire population. The survey began in 2001 and is conducted normally between February and December, with the results being released the following August. It is one of StatsCan's largest surveys. It's approximately 65,000 respondents each year and about 9,000 in BC. It's important to note that the results for the population groups do include race and cultural background. However, they do not include First Nations, Métis, or Inuit categories. And even if those categories were included, we would not include them in things report when it's seeking permission on CCHS objectives. Sorry, CCHS, I mean the Canadian Community Health Survey. So being in government, anybody who's in government, I know there's a lot of government organizations, we absolutely love acronyms. So the primary use of CCHS data is surveillance of population. Sorry about that. Here. The primary use of CCH data is for health surveillance and population health research. So federal and provincial governments of health and human resources, social service agencies, and other types of government agencies use the information collected from the respondents to plan, implement, and evaluate programs to improve the health of Canadians. Researchers use the information to better understand health issues, including the impact of risk and protective factors. Nonprofit organizations and media use the CCHS results to raise awareness about emerging health issues. Summarized data tables are made available on the Statistics Canada website, with the downloaded results for this report coming from three main sources: a provincial comparison, pooled regional comparisons, and a population comparison and trends over time.
Mike, I think I have access now.
Oh, great, Tamara. Do you want to jump in?
Yeah, I can take over. I think you've done these slides, right?
Yeah, on to the next slide.
Okay, sounds good. Thank you. Sorry for the technical difficulties. So my name is Chamir. So the purpose of the CHS Canadian Community Health Survey PowerBI report is provide one place for people to go and get the information. We are producing a lot of policy briefing notes, fact sheets, and other data requests. So when we are doing that, analyst doesn't need to go and look for the data. So the people who producing it can look into these already pre-prepared reports. That was our main purpose. Then whenever data is available, we are going to update this. Then the up-to-date data they will be able to get. So we have a portal which has a lot of other interactive reports. You already come with knowledge about how to filter get the data because they are get used to other reports. Then they will be able to get those things, and most of the data requests they can fulfill themselves. That's what we want to do with most of our data. So we are using this open data to put together and give better pictures about the using the Canadian Community Health Survey. So the data are already publicly available. As Mike mentioned, we downloaded through the website. Then we use the standard other visuals and graphs tables, and we did a time series, data visualization and tables. And then this data downloads from a separate data files, a lot of rows, columns in the when you download CSV Excel. So we did the processing to bring to one place and publish it and bring it to the Power BI. Then once we put it together, people can use it as a visuals or connect those copy paste those visuals to their own Power BI or their own presentation, or export these data into if they want to produce some specific things. Then this is the survey data, which is very important because most of the time we have ministry has data which is available through administrative data. Anybody who is used the healthcare systems, we get information, but survey data is unique opportunity that we can get more information about individual and their perception, whether they use or not healthcare, such as whether they have a healthcare provider or some other information like their vegetable and food consumption. That type of information is not available with us. So this is very helpful to fill that gap. And also this data is, we use this data already pre-aggregated summary data for this report, but some publicly available micro use data through university or data initiative, and other linkage may helpful for if we figure out something we need to do further analysis. So this is a very good window to identify further studies we have to do with the data to identify a healthcare gap. Next slide, please, Mike. Yeah, so let's talk about how we start producing the Power BI report using openly available data. First thing is go to the websites and download that data. So we downloaded 4 data holdings. One is a comparison with the provinces and territories. One is little bit lower level of health geographies, like for BC, as example, it is go up to health service delivery areas. It is lower level than the health authorities. Then the other 2 data release. One was ethnicity and education, and also there was another one for income, the income level. That type of different development stratified data we downloaded. Then we look at the data. What are the common dimensions? How we can process this data to bring before we bring into Power BI. So when we processing the data, we use Power BI build data processing tool called Power Query instead of using RO, the data processing tool, given that it is easy to use because already pre-aggregated data we are using, and confidence interval, statistical significance, and everything already available on the data. So we just need to identify the data, like which way we want to keep the columns and rename that type of thing. So Power Query was a very good tool to do that. Whenever we want to refresh the data with the new data, we just need to replace the table with the new table. Then we will be able to easily update the reports. So we use the Power Query to do the processing. When we doing the processing and creating the data model, we use this tie schema. That is basically identifying what is the fact table and what is the dimension. Dimension is the information we use to slice and dice the information. Example, so we want to see the geography as a one, then the time period, then the indicator related information. Those will be dimension table. Then the fact table, so each indicator, what is the specific percentage value and whether it is statistically significant previous period and compared to Canada, that type of things. Then when we create the data model, we separate the fact and dimensions. So using the key between the dimension and fact, as example, geography table have a geographic ID, then the fact table also that ID, we did the relationship, one-to-many relationship when we are doing the data model. After doing the data model, we start building, writing measures to use on our reports. Those measures are helpful for to show like dynamic titles. Somebody will select some specific indicator for a specific year, that all the titles will be updated on our report. Similar to some other information to include for our Power BI report, we have created some measures. So we want to show the all the measures which we are doing better in BC in green and which we are not doing better as orange. That's something conditionally shows some colors. We have to write measures. So we use our BI data analytic expression called DAX for building these measures. So once we have done that data model and all the measures done, the final stage is developing the visuals. So when we developing the visual, we use the standard formats we use at the ministry, because the users, executives, and other people will be much familiar with the tool, how to use and navigate. So Mike will give you a quick demo about how we have done the report with the different navigations and filterings. Then we will talk about the what we can put together as um, findings. Thank you, Mike.
So yeah, as Char said, so right now we've got an actual live version of the report up on the screen here. So this is the first page that a user is going to see when they open up the report. Actually, sorry, this is the second page that they're going to see. Our first page is kind of a snapshot page, which has some kind of KPIs, but we're not going to go into that today. So the page opens up with our kind of standard slicers for year, sex, and age group. Right now, we've selected one of the 40, I believe it's around 40 health indicators that are published by Statistics Canada, focusing on self-reported physical activity, 150 minutes per week. And the upper chart here is showing you a view of all the provinces in Canada and the rate of physical activity, sorted from the province with the lowest rate to the province with the highest rate. And for this, it happens to be BC has the highest rate of physical activity in 2021. A user will easily select through here and select different years, and you can see in 2020, Manitoba and Brunswick actually had the lowest rates of physical activity, while BC still remained the province with the highest rate of physical activity. The chart at the bottom here is just based on the year, sex, and age group, and it does not interact with the indicator slicer, and it shows indicators based on those slicers that are either performing statistically worse or statistically better when compared to Canada. So you can see there's 4 indicators here where BC is statistically worse. Again, this is a BC focused report. I know there's people from all over Canada here, but this is going to be focused on BC. So yeah, this is saying that there's 4 indicators where BC is statistically worse. You can see for Canada's use, for having a regular healthcare provider, perceived mental health fair or poor, or perceived mental health very good or excellent, are areas where BC is performing worse statistically when compared to Canada. So it gives a user a quick view of the indicator that we may want to look at, and indicators where we may not be so concerned with it. You can see that self-reported physical activity is an area where BC is statistically better than Canada. The next page is the times, that's just a standard time series page. So sticking with our indicator of self-reported physical activity, the upper table just displays the actual value for for all provinces. In this instance, it's sort of from west to east, and shows the value between 2015 and 2021. You can see a time series graph down here below. Right now, we've selected for Canada, Newfoundland, and British Columbia. You can bring in other geographies, or you can select a different indicator if you'd like. That's for examples. See, it also has a very low rate, the rest of that in terms of mass index. There's no confidence intervals, so total value with the upper and lower 95% confidence interval shaded, so you can get a sense of the variability of the data. So you can see that for Newfoundland, a little bit wider confidence intervals, so a little bit more variability there. button here for age and sex. I'm just going to turn it back to self-report physical activity. Let's stick with this theme for now. There's a button here for age and sex, and so this shows all of the indicators by age and sex that are either statistically different from the prior year period or from Canada. So this upper chart, the differences are based on the prior year. So for the 18 to 34 female group, there's been a 12.4% decrease in the amount of physical activity. So that's something that we want to probably look at. There's a filter here where users are able to select for whether the indicator is not statistically different or whether it's only statistically different from the previous period or only statistically different from Canada or from both. It defaults to both, and we'll just kind of leave it at that for now. And then there's this table here at the bottom that just shows the values rather than present them visually. It's just a straight table, and you can see from the colors, green indicating indicators that are statistically different from Canada in a better way, and orange indicating statistically better in a worse way. So you can see that for the total 12 years and over for females and for 18 to 34, it's actually statistically worse compared to the previous year, but for the total 12 years and over, it's still statistically better than the rest of Canada. So getting worse in BC, but still better than Canada. Now, this next page is just kind of meant as a quick summary page. So this is where a user can come and just quickly scan through the table and see which indicators quickly are performing better or worse compared to Canada or the previous period. Again, this is with the conditional color coding that Chamara mentioned that we built in as a measure. So you can see here that there's a few indicators where BC is statistically better. We talk about body mass index, obese, youth obese, current smoker daily or occasional, diabetes. Those are areas where BC is statistically different from Canada in a better way in 2021. But then you can see indicators where BC is statistically worse compared to BC. So having a regular healthcare provider, perceived mental health fair or poor, and perceived mental health fair or excellent are areas where BC is statistically worse compared to Canada. The user also has the option to select the Alt Indicators button here. And what this does is it shows all of their health indicators by year, again, using the same color coding as to whether or not the value is statistically better than Canada by selecting this button, or by selecting this button, they can see whether the value is statistically different from the previous period. So you can see here again, here's fruit and vegetable consumption. We've seen a decrease in fruit and vegetable consumption for females and for all sexes as well. There's also an option here to select the confidence intervals, again, to get a sense of the variability of the data. We have a geography button here. So for the geography button here, we've broken the indicators down by BC Health Service Delivery Area. BC Health Service Delivery Area is the second hierarchical level in our geographic breakdown for BC. So it's not at its lowest level, but it is a lower level than health authority. There's 5 health authorities, and I'm not sure how many BC Health Service Delivery Areas they are. One thing to note is that in order to get an adequate sample size for HSDAs, StatsCan pools 2 years worth of data. So right now, the most currently available data was for 2019-20, although I believe there's 2022 data is up to date. So instead of filtering on exercise, we're looking at current smoker daily. So you can see that the BC rate is 6.3%, the Canadian rate is 9.5%, but there is some real variability in BC for current smoking rate. So you can see there's a low of 3.3% in the North Shore Garibaldi area, and up to a high of 13.4% in the Northern Interior area. And you can select that area here, and it will filter down, and we can see that it is statistically different from BC.
I think we have 5 minutes, Mike. A few minutes, yeah.
Sorry?
We have a few minutes.
Okay, thanks, Shamar. So next we'll go to our Canada map here. I'm not sure if we're presenting until 11:30 or 11:45, to be honest, but okay. So here's our Canada map again, looking at the indicator current smoker daily for these age groups, year and sex. Lighter colors indicate a lower value, of the darker values indicating the higher value. And you can see just quickly glancing at Canada, Looking at current smoker daily, it looks like kind of rushing here because again, I'm not sure if we're done at 11:30, but we've also got a population group.
We were told that it is 11:30.
Oh, okay.
Yeah.
Great. Well, we also have this population groups page. Again, going quickly here. The population groups allows users to select by ethno-cultural group, and they have cultural, racial background or immigrant status. It also allows for the ability to go to income and education. For this, it selects by income quintiles, Q1 being the lowest 20%, Q5 being the highest 20%. As well, we can select by education. And this is for less than secondary, secondary graduate, secondary postgraduate. So yeah, just quickly, if we have time here, I'll just go through our finals. So some of our key findings. So BC's population tends to be better off in terms of body mass index. BC is better than Canada related to healthy behaviors and indicators related to health outcomes. BC consistently has one of the lowest overall rates of smoking and highest rates of physical activity in the country, although there are regional differences in those rates. So not surprisingly, then chronic diseases that are often related to poor health behavior, so smoking and COPD, or lack of physical activity or unhealthy diet, diabetes or high blood pressure are areas where BC population is better off than the Canada average. BC is worse than the Canadian average when it comes to the percentage of people who say they have a regular healthcare provider. For the population overall, though this is not the case for people age 65 plus. Self-reported health status indicators related to having or not having a regular healthcare provider are areas where BC performs statistically worse than Canada. In particular, areas related to mental health and cannabis use. So our next steps, we're going to continue to look for updates. I believe the 2022 is ready. We're going to explore ideas to make the report more widely available. Currently, this report is only available to Ministry of Health staff. We'd like to open that up to everyone. We want to expand methods for comparison and longer term trends. The current report compares only previous year, but methods could be applied to explore 5-year trends. And we want to explore inequalities further. So we want to look at options to generate age standardized results and add more summary measures that maybe describe gaps in healthcare. So thanks again for the opportunity to present today. Apologies for some of the technological issues there. But if we have time, if there's any questions, we're open to any questions.
No questions in the room. Oh, do you mind coming up here because we don't have a proper mic? Yeah. Come on, yeah.
Come on. Thanks, Mike. Great presentation. Just a quick question: whether the data allows for further desegregation by indigenous identities, indigenous community identities, for example, Canadian groups, First Nations, Inuit community, and if it allows for further segregation within the First Nations, for example, status and status effects on reserve, off reserve data.
Sorry, I had a bit of a hard time hearing that, but I believe there was a question around data collection in Indigenous and First Nations groups and whether that's available. That's not available in the Canadian Community Health Survey data. And I think, I believe it's out of respect for First Nations and Indigenous data sovereignty, and wanting to consult with Indigenous First Nations before releasing any kind of data related to First Nations. I don't know, Tamara, if you have anything to mention about that at all. Or...
Yeah, most of our Ministry of Health data release, we don't disaggregate by health Indigenous or First Nation identities unless we have specific request and consultation with Indigenous. The feedback, and we want to make it a respectable way reporting. So this data set anyway we don't have. So recent survey they did, the BC demographic survey, they have that information. So future maybe we will publish with collaboration with presentations and they are with working with them. But so far we don't disaggregate any of our data that based on that.
Another question for you guys.
Yeah, thanks. And just for some context, my team's at a kind of very early stage of proof of concept of Power BI. And I'm just wondering how straightforward it was to use the custom geographies for the sub-regional, the color-coded map that you showed. And is that a pretty straightforward process that Power BI supports, or did it require some custom coding or that kind of thing?
Can you just what we're talking about? Yeah, Chamar.
Yeah, so I'll take it. So we have standard geographies in Ministry of Health, and we have so those standard geographies we already have pre-built maps. So this map